Giving birth on the side of a remote highway is not how anyone wants to bring a child into the world. But for many in Queensland's Gladstone region, it's a very real possibility.
It's coming up to 200 days on bypass. So for a town that births 600 births a year and has about 900 women booking in antenatally, this is huge.
Since last July, Gladstone Hospital has been on what's known as a birthing bypass, a severe shortage of specialist doctors forcing expectant patients to travel over 100 kilometres to Rockhampton for the care they need.
I mean, the Health Minister just needs to act. This comes down to, follow the funding. Even the federal government could intervene in this and actually hold the Queensland government accountable for the lack of services, because they're getting paid to actually fund state maternity services and they're not doing it.
For months, residents have been trying to draw attention to the crisis. In December, protesting in front of the office of their local MP, demanding action. In a statement, Queensland Health told us,
"Without an appropriate level of staffing, we cannot operate a service without exposing expectant mothers and their babies to an unacceptable risk. We will absolutely not do that to Gladstone families."
Gladstone Hospital still offers elective C-sections on a limited basis, and many are now demanding the procedure in order to avoid the risks associated with the long trip to Rockhampton.
We are going to lose a mother or baby. We know that there have been some very, very, very close cases lately where women and their babies' lives have been put at risk, but it's only a matter of time, and I know staff up there are concerned of the same issue.
Well, Gemma Manwaring runs the Save Gladstone Maternity Ward group and joins us now. Gemma, how did things get to this point where they're so bad?
Yeah, it's at a really concerning point now. We're well past the 6-month mark. The problems stem way before July last year. It sounds like a really long time ago, and it is for the local mums here. Ultimately, it's a failure to adequately plan and prepare for staff absences that have led us to now.
So what's the thing that's most distressing to expectant parents? What are they most worried about?
Look, when we have a baby, it's always uncertain, but this is certainly adding and compounding the uncertainty that mums are facing. The road trip from Gladstone to Rockhampton, where we now need to birth, is not an easy road. It's the Bruce Highway and it's got its faults. In addition to that, now we've just had about 40 mils of rain here in Gladstone in the last couple of days, and already I've had local mums reaching out asking me, what do we do if the roads are cut, which is a reality for us in the wet season. And they're asking, what do we do if the roads are cut between Gladstone and Rockhampton? The lack of answers from the Labor government are also really concerning. Local mums have been incredibly vocal to our local member, Glenn Butcher, and the lack of answers that he's been able to get from Central Queensland Hospital and Health Service and from Yvette Darth, the Health Minister, are appalling.
Obviously, we all know that health services aren't delivered equally across the country, but you're all paying your taxes just like everyone else. Do you feel that you should be able to expect at least a basic level of care if you are having a baby?
Absolutely. It's what we had up until 6 months ago. I had my own babies here in town. My children are 15 months apart. So essentially I left one baby to go and have another. When I thought I was in labour and I thought my waters had broken, I could just duck up to the hospital. It's 10 minutes away. I could then come home and sleep in my own bed before going back up the next morning to see what else was going to happen. At the moment, we don't have that. We're not asking for a full-blown tertiary hospital like what is in capital cities. That's not what we need here. We just need our maternity ward back. We want back what we had before.
And Gemma, as a mum of 6 myself, I share your fears, and it's a really bad situation right now. How much worse do you think it could get?
Look, at the moment, we're really concerned with the birth trauma that surrounds all of this uncertainty and lack of answers, but also mum's mental health. As you said, you're a mum of 6. I've got my 2 babies here. We know that having a baby is such a special time, and we need a maternity ward that's close by that provides that care, but also the continuity of care. There's a huge interruption of care between having our antenatal visits here in Gladstone, which are still being provided, but then going to Gladstone to be assessed and then to be transferred up to Rockhampton. The trauma in that alone is really difficult to comprehend. But there's instances where mums have been transferred in ambulances with other patients who they don't know. That's traumatic. There's instances where mums have had emergency caesareans in Rockhampton, which were warranted, but then they're far away from their other children and their family here in Gladstone. Gladstone's very transient. We've got, my own family where I grew up, they don't live close by. And so it's not always a case of having grandparents who are 10 minutes away to come and look after older children when a mum goes to have another baby. So just that huge interruption of care, mum's mental health, the lack of continuity of care that we're experiencing, and just the birth trauma that can come from all of this uncertainty.
Gemma, thanks very much for your time tonight.
Thanks.
It's such a big issue when you think this is how we all got here. And it wasn't all that long ago that going into labour was a leading cause of mortality. And having had my first baby, an emergency Caesar, it's not about being too posh to push, or whatever that silly quote was. That I really hope that the government makes this a priority.
Yeah, absolutely.